Hello and welcome to this Rogers TV program dedicated to COVID-19 and providing you information about resources available in your community. I'm Carol Merton, and before I welcome the guests to the show, you probably, for those of you who watch the show regularly, will know I like to say a few words just at the very beginning. On Thursday, January 14th, 2021, as part of the declaration of the second provincial emergency, a stay-at-home order was issued. This order and other new and existing public health restrictions were aimed at reducing the number of daily contacts with those outside your immediate household. We are all now on the front line. We are all working together to stop this virus and also the variants that are spreading. This virus will seek every opportunity it can find to spread by finding loopholes. Let's not give it that chance. This is hard work for all of us. It is hard to be isolated and have our daily routines disrupted. It's gone on for a long time, and we are all weary. On the horizon, though, there is hope. There's hope that in the next few months, more vaccine will become available for those who choose to be vaccinated. For now, though, never underestimate the value and importance of what we are doing by following the public health unit guidelines. The sacrifices we continue to make each and every day are helping to prevent the spread of COVID-19. We are saving lives. I want to thank you and the community for following these guidelines and encourage you to continue to do so until we can celebrate and be able to see each other in person again. And on that note, I also want to welcome our guests today to the program. So I'm pleased and delighted to have from the Owen Sound Family Health Team, the Executive Director, Paul Hoban, and also the Program and Service Manager, Rona Cobean. I trust that I have your titles still right. In COVID-19, the titles are changing. I can't keep up with it. So if I've made a mistake, please correct me.
No, perfect.
Thank you. Thank you for being on the program. I know the first time we did an interview, there were three and everyone was wearing masks. So it's kind of nice to see your faces. I know you're in separate rooms and it's just, you miss that. You don't realize masks really do change the conversation. So thank you for being here. I'm really interested, first of all, in knowing how everyone at the Owen Sound Family Health Team is managing, and how has the second wave impacted the services that you're providing? So I'll turn it over to whoever would like it to take it away from there.
Well, I think we've been doing okay. It's still a struggle. We still have to try to convince patients, especially our older patients, to be accepting of not being able to come into the family health team. Ultimately, what we want to do is ensure their protection. The last thing we want to do is find a patient who we've spread the virus to, or COVID-19 to. So we certainly want to protect them. But I think ultimately, the majority of our patients are excited about what we're doing and excited about virtual visits. It's far more convenient for them. They're able to, you hate to use the word bang for your buck, but they don't have to come out. They don't have to spend the 2 or 3 hours to travel to the family health team and wait for services and then get it. They can get it over the phone or through a video chat, which is I think our younger patients are certainly excited about that.
Rona, how about you and your programs? I mean, how has it, they used to run a lot of programs there at the Family Health Team and group programs. What's changed from the program perspective?
So our programs have changed somewhat, but to be honest with you, they've actually, they're running quite well now. And you talk about the second wave, and in essence, here on the Family Health Team side, where we're running the programs and stuff, the second wave really didn't affect us in much way because all of our stuff is virtual. So our classes are actually growing. We've got more and more classes going online. We've got more patients coming on board online, which is really nice to see. And I think too, it's January. You know, it's cold, it's icy. No one wants to be outside anyways. So if they can join a fitness class or they can join an educational class on heart healthy eating and they can do it just from the comfort of their own home, it's actually been pretty good.
And certainly weather is always a factor here, certainly in Grey Bruce, without a doubt. I'm
For sure.
wondering, Rona, if you mind, can you run through some of the programs that, because, you know, we want people to stay healthy. We want them to be engaged. Maybe if you wouldn't mind just saying some of the programs that you currently have and do they cost money? How do people access your service?
So none of our classes cost money. There is no money passes through hands. They're all free to everyone. We have lots of classes. We have a stress management class, which is like a 4-week session once a week. We also have a yoga for stress management class, another Forever Fit class, so a fitness class. So our OT, she's working from home. Our occupational therapist, she works from home, and she runs these fitness classes and the yoga class from her home, and everyone joins on. And so actually we've seen a bit of an increase in the people that are signing up for it. We also have a heart healthy eating class. And again, our dietitian, she's working from her home as well, and she runs these classes from there. So heart healthy eating, we have a picky eaters, problem feeders class for those ones with little tots that they're just having a little trouble getting them to introduce different foods to. We run that virtually. All of our classes are ran virtually. So it actually, I'm just trying to, off the top of my head, think of some of our other classes that we're running. We have a diabetes class for those that are newly diagnosed with diabetes or have diabetes and just want a refresher on it as well. Again, all virtual. So if you check on our website, they're all listed on our website. And if you're interested in any, you just give us a call and to extension 103. Or if you follow the prompts when you give us a call to programs and services. And our program assistant here can sign them up to any class.
So at the Family Health Team, you offer both physician visits or nurse practitioner visits for people who may need to have that direct care. But the other side is also the programs and services for people to be engaged and stay healthy. So by using video technology, are you able to actually increase the number of people in classes? Were your class size restricted because of the rooms before, or has it helped with the sizing of the classes?
I think from a class perspective.
Interesting you asked the question.
Sorry.
Sorry.
It certainly has increased the size or the ability for us to increase the size of classes, but also has allowed us to ensure a patient's privacy, which is still remains extremely important to us. I think the more important thing that it has done is it's actually increased our productivity one-on-one with patients. So our dietitians, our pharmacists, our social workers are able to see more patients virtually than they were able to see in person. And I know that sounds strange, but our clinicians are extremely productive at home, which is exciting to see. And it was not unexpected. We absolutely expected a staff member to be more productive at home.
Interesting finding. So that leads me to ask the question, when we are COVID free, and hopefully we're all anxious for that, do you anticipate that you will continue with a kind of virtual model of care? Is this, I always ask people, what are we learning through this? I mean, it's been a hard, difficult time, but there are some positive things.
I think what you'll find is that we'll have a hybrid. There's going to be patients that will want to be seen in person, and we're going to provide those services for them. But there's also going to be patients that will want to be seen virtually and are comfortable being seen virtually, and we'll also accommodate those patients.
So having a mixed model is something definitely you're considering for the future. What are the practitioners, all of the healthcare providers saying about virtual care? Because it's different when you're not in the same room with someone. What are you hearing back from the dietitians, the social workers, the OTs, all of those people?
So they do miss that face-to-face interactions, because we all know that seeing somebody's social cues or their body language does tell us a bit about what else is going on. So they have noticed that. We do have a virtual access through our computer system that links right to our charts, that we can have like a face-to-face just like this. So they do find that those are good and interactive. But of course, there's always a delay when we're on a computer, and you just don't quite get that visual, right? But they've worked through the struggles. The phone calls work, and actually we've had some interesting feedback from patients who like that phone call. They don't have to take time off work, or if they're at home because their children are at home, they don't have that worry about trying to get everybody bundled up to get them here to an appointment. So yeah, it's been interesting. The healthcare providers themselves are finding it a bit of a struggle, but they're working through it.
One of the advantages of having the team is that ideas are shared, and people can say, well, if you have a shared patient, you can exchange ideas. How does that work at this point in time? Do they just call each other and talk about a patient? What more can we add for someone?
Yeah, they do phone calls back and forth. Some people are still here in the building. Some of the staff are still here in the building. Our dietitians, our social worker, pharmacists, and occupational therapists are all at home. But we do have an interactive computer system here that we can actually live chat to each other while they're working from home as well. So Excellent. They can have that conversation back and forth, but also pick up the phone and call.
So that option is available through your system, which is it enhances the care that a yes. patient, when you have collaboration like that, where healthcare people can talk together. Are you seeing any different or new healthcare challenges because of COVID? I'm not referring to COVID specific, but are people delaying getting care? What are you seeing at your facility?
Yeah, I think we are seeing a bit of a delay of people wanting to get care. When we're going through a bit of a preventative care blitz right now, shall I say, and getting it out of people that needing their mammograms and their colorectal screening and that kind of stuff. So we are seeing some hesitation of people not wanting to go to the hospital for testing, or not wanting to go to the labs. But for the most part, people are pretty good. And I mean, just a little bit of an encouragement and explaining, how to keep safe while in those settings has been helpful as well.
Paul, from your perspective, I mean, you're the executive director of this whole facility. What sorts of things have changed for you?
From a business side, I think Rona hit it on, she's spot on with that, where it's more of a clinical perspective that things have become more difficult. From a business side, the accounting, payroll, HR, those are all things that remain the same. They can be done wherever you are. You can be working from home and still cut checks. You can still do payroll. You can still do HR issues or send emails or things like that. But it's trying to build a trust within the community that, especially the elderly, feel like they need to come in and see their doctor or their healthcare provider every couple of months, that they're not comfortable with doing it over the phone. And just to get out and to let them know how important it is for them to stay at home and not to come into a facility if they don't have to. The thing we want, this community has been extremely successful in controlling the spread of COVID-19 and the number of deaths that come from this community or come from COVID-19 in this area, and we want to continue with that. We want to. So that was probably been a big.
We're hearing more and more about mental health and the challenges relating to isolation. I know, Rona, you mentioned about stress, but what are the linkages that your programs have with other organizations or agencies if you start to get the contact with people and you're concerned about their mental health? What sorts of options would you also include?
We do have a great mental health department here within us. So at the beginning of COVID, we had a phone line. If patients were calling in, the staff from the doctor's side could refer them over here to one of our nurses who could help them with those. Where do I get food? How do I do this? How do I do that? Mm-hmm. We found it very useful at the very beginning of COVID, and then it has sort of like petered off only because they've found other resources, and there's been, of course, government assistance and stuff like that have been available. But our nurses right now during this second wave of COVID have been reaching out to all of our patients over the age of 70 and touching base with them just to see, how are you doing? What's going on? Checking in on their physical and mental health as well. And then resourcing out to community as well as to our own mental health department if need be, reaching out to their doctor to say, I've just spoke to this person and I'm a little concerned about some issues. So we've been trying to touch base with patients as the time has been going on, because we recognize after we're almost at a year now, this is going to be, it's taking a toll on everyone. Yeah.
And isn't that what a family health team really was set up to do? Take care of course, those who are ill, but also preventative medicine and connecting with the community. Mm-hmm. And from what you're describing, the pandemic has actually encouraged that outreach even more than you were doing before.
Right.
So anything surprise either of you, as we go along? You talked about the efficiency of the healthcare providers on the phone, but you kind of thought that might be the case. But anything different that, you just never anticipated?
I did not think we would have the number of children's mental health issues that we're experiencing. I certainly thought adolescents, teenagers, and adult mental health there would be a lot of issues, but I didn't think there would be as many children struggling. And what we found is that there's been between a double and a triple increase in the total number of referrals for children's mental health.
Is that because they've not had the school opportunity, or it's been restricted? Do you feel that?
So we haven't had the time to drill down on the why,
yeah.
But we will. But it's been a huge increase in the total number of children being referred to our children's mental health social workers.
Great that you have the service there to address the need, but very concerning to hear that that's happening, and it's a trend, as you say, that maybe wasn't expected for the younger ones, certainly. So, sir, it would be interesting to know as you drill down, what sort of factors might have contributed. Anything for you, Rona, that other than what you've mentioned that surprised you? You didn't expect.
No, I don't think so. I think, I think Paul has said, what sort of has been our big thing during this whole pandemic is the children's mental health. Yeah.
A couple of things that I'm noticing, and we've often thought of younger people as being tech savvy, and they are. Oh my goodness. But I'm amazed that a lot of the seniors, all of a sudden, they've got their iPads and they've got their Zoom accounts and they're just connecting. Yeah. And they're connecting with each other. And I think it's great when you live in a rural, municipality and city, that people can start to get those connections and network using the technology. So, I'm amazed, and I think it's wonderful actually that it's opening things for people to stay connected and have book clubs and chat about things where they don't have to be together in one room. So, it's amazing. People will find a way, one way or the other, for sure. But we won't test the knowledge between techies with the young and those who are more seasoned. Tell me about vaccinations. What's in store for us and for your facility around vaccine rollout? Because that's the good news story we're looking forward to.
So I think I'll leave this to Rona. She's in charge of our COVID-19 task force. She's been dealing with public health and the Ministry of Health. So I'll stop talking and let Rona explain everything that we're doing.
So we take all of our direction from public health, and they of course take their direction from Public Health Ontario, the Ministry of Health. And so there is a framework that is out there of sort of who's next in line. So, we're in constant talks with public health of, who's going to get the vaccine? Can we have it here to administer it? There's a lot of logistics behind the vaccine and behind how it's administered and how it needs to be recorded. And so, of course, public health is going to take the lead on that, and they're going to give us direction on how that happens. Whether we physically get vaccine here or not is still up for question, and whether it will all be done in mass clinics. And there's a constant sort of discussion around what is the best method, and looking at the entire area of Grey and Bruce of how is the easiest, most logistical way to get it into those arms. So as far as getting it here, right here at the Owen Sound Family Health Team, that might happen, might not happen, we don't know. But we do know that we are going to have nurses that can go out there and help public health as well, to get that into those arms when we can.
I know that physicians in our area do sometimes make house visits for those who really, really can't get in, or it's too risky for them to go out. So the concern is, if they can't get to a clinic, will there be a strategy in place to get the needle to the arm, wherever that arm is?
Yeah, again, public health has been actually talking about that at their task force table of how do we get it to those people that can't come to us. Many different discussions of, mobile clinics and ones, going door to door kind of thing to those ones that can't physically make it out to a clinic. I'm not 100% sure where they're at that point, but I do believe that is definitely part of the major part of the discussion of because those are people that are at huge risk as well, right? So they do sort of like come up a little higher on the hierarchy of who gets the needle at what time and when. But how to get it to them, that is definitely in the discussions at the public health table, yeah.
And that's good to know, because we don't want anyone left behind.
Oh, absolutely not.
We know there's a scale and we know there's a priority, but we don't want to forget any group. Those at home, those who have no home, are another group as well.
And if I can give any piece of advice to a person that is wanting that vaccine, my piece of advice is just sit back and wait and listen to the media as to when it is your turn, when can you book. We do not have it here. Much to some people's belief, we do not have any here. We are, it will be those appointments. And so just sort of sitting back and waiting and watching the news to see when is it going to be my turn.
And one thing that I would like to say is that I would like to ensure the public, the family health team, employees and their family will not skip the queue, ever. We will never take a shot in our arm before patients and residents of this community get theirs.
I am so pleased to hear you say that, because we're all about caring for others, right? In healthcare, that's what you're doing. And what you're saying is that's your philosophy of care, and it applies even to the vaccine. And I'm really pleased that you spoke up and said that. That says a lot, and I think our public need to understand that, that's important for sure. Okay. Well, I'm really pleased to speak to both of you. You always have lots of information to share, and I do appreciate you taking the time. I want to thank you for what you're doing to keep our community healthy. It's really important, and you've obviously modified how you're doing it. I wish you all the best, and please feel free to join us anytime to share information.
Thanks for having us, Carol.
My pleasure. Thank you to our viewing audience for joining us as well. Please join us again to learn more about programs, services, and resources available to you and to your family. Please take care and stay safe. Thank you.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line. Email us or connect with us on social media.
Fun, casual, intimate, and personal chats with artists and creative folks in the LGBTQ plus community and friends, all on Season 7 of On the Couch.
You know what?
Operation Smile, alongside our medical volunteers, provides safe cleft surgery to children free of